Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anish Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about the benefits of exercise in the care of patients with breast cancer with Drs. Sanft and Melinda Irwin. Dr. Sanft is an associate professor of medicine and medical oncology, and Dr. Irwin is the Susan Dwight Bliss Professor of Epidemiology at the Yale School of Medicine, where Dr. Chagpar is a professor of surgical oncology.
So maybe we'll start off with each of you telling us a little bit more about yourselves and what it is you do. Tara, can we start with you?
So I'm a breast medical oncologist. I've been practicing for about 14 years. I see patients who are recently diagnosed with breast cancer, and I also run a survivorship program here where we have a multidisciplinary approach to cancer survivorship in a clinic that includes a physical therapist, a dietitian, a social worker, and a physician's assistant. There we see patients of all diagnoses after treatment.
And Melinda, can you tell us a little bit more about yourself and what you do?
Sure, happy to. So I am trained in both epidemiology and exercise physiology. And for about the past 20 years, I've been leading, along with colleagues such as Tara, clinical trials where we look at the effect of exercise and also sometimes the role of weight management and nutrition on various cancer outcomes. We've looked at this in breast cancer and other cancers, really trying to figure out the role of exercise in mechanisms for improving prognosis, but also its role in patient-reported outcomes and how exercise can improve that. And much of the research that we and others have done has informed guidelines that are now making its way into standard of care for treatment.
And so to that point, Tara, can you talk a little bit about the role that exercise plays in kind of the treatment and management of patients with breast cancer?
Sure. Exercise has been shown to improve many outcomes in survivorship and even during treatment. There's very strong data that suggests that exercise improves cancer-related fatigue, reduces anxiety and depression, improves sleep quality, and helps patients maintain function both during and after treatment. There's also data that's emerged that shows that patients who have more physical activity in their life may have better long-term outcomes in terms of reduced breast cancer recurrence and better overall survival.
And I might just add to that, what's really exciting is the research that we and many others have done has really shown that even little bits of exercise or physical activity can have an impact. So it's not necessarily, high levels or high intensities or high amounts of exercise that are required, but it's pretty compelling evidence that doing something is better than nothing. So even if it's, the recommended amount of physical activity is 2.5 hours per week, but there's evidence showing that even less than that amount is beneficial for outcomes.
And so, when should patients really start exercising? Because Tara, I think that when people are initially diagnosed with breast cancer, their first concept is, oh my God, I've got breast cancer. Not, let me see what I can do to increase my exercise. So can you talk a little bit about when people should start integrating more exercise into their lives? Ideally, it should be before they ever get breast cancer. But how do you have that conversation with people and start getting exercise into kind of the treatment algorithm, if you would, for people with breast cancer?
Yeah, thanks for asking that, Anise. I find this to be one of the most compelling times in medical care, which is, soon after diagnosis. It's unusual for us as adults to really make major life changes sometimes until we have a teachable moment. Example is maybe becoming pregnant for the first time or having a heart attack, for instance. And cancer is one of those times when, as adults, we tend to be open and motivated to make major changes. So first of all, we should all be exercising, all of us. But we know that the vast majority of us do not meet the recommended guidelines of 2.5 hours per week. And as Melinda said, something is better than nothing, but a lot of people are not meeting even close to that. So soon after diagnosis is this teachable moment where we can start to help our patients become a part of their care by giving them more control over what they're doing between visits, at home, by moving a little bit more. Now, that being said, there are a not insignificant number of patients who are overwhelmed with the diagnosis process, understandably. And certainly we don't want to shame people for not being able to adopt these healthy behaviors right away. And that's, where survivorship comes in after treatment, to really encourage patients at that point to start to rethink their approach and maybe tweak what they're doing a little bit to optimize their health after treatment. Anywhere along the spectrum, we want to encourage patients to do this because it has so many upsides and very few downsides.
Yeah. And Melinda, maybe you can talk a little bit about some of the trials that you've done and shed a bit of light into, has the research been done kind of at diagnosis? Has it been done more in the survivorship period when people are going through chemotherapy afterwards? And talk a little bit about, kind of where this a little bit is better, something is better than nothing comes in, and whether there's a minimum, right? Like if I exercise only 10 minutes, is that good enough? Can you talk a little bit about the research that's been done in this area?
Sure. Yeah. So for probably a good 10 or so years, most of the research looking at exercise after cancer diagnosis has been in the post-treatment setting. So after chemotherapy and or radiation treatment, looking at how exercise might improve patient-reported outcomes, sleep, quality of life, fatigue. And from the research that Tara and I have done, as well as many others, has shown that some patients, not all, but some patients, when they hear of the benefits of exercise in that post-treatment time setting, and they hear of potential benefits that it could have had during treatment, they ask, why didn't I receive this information sooner at diagnosis? And so as Tara suggested, some people do want that information earlier and assistance in adding exercise into their routine during treatment. And so Tara and I actually led a trial together that just completed and was recently published that was an exercise and nutrition intervention during chemotherapy for breast cancer. And when we say exercise, what we mean is what we prescribed for these women was primarily a brisk walking program that could be done at their home, in their neighborhood, as well as we developed a home-based resistance strength training program in their home. We created material to help them figure out which exercises to do. And the importance of initiating this during treatment is to maintain or even maybe increase a bit your muscle mass, because we know that muscle is important for various outcomes, and there could be adverse effects of chemotherapy on muscle. So the idea of exercising either with just brisk walking, which is a weight-bearing activity during treatment to maintain muscle mass, but if not, then in the post-treatment setting, helping to improve other outcomes is really important to think about. And one of the approaches we had our study participants consider is that, shortly after diagnosis, friends and family and neighbors are very, want to help out and often bringing over meals or whatnot. And so we recommended that if there was an opportunity for them to set up a time each week to walk with someone, a neighbor or a friend, that might be helpful as well. And, so these walks could be for 10 minutes or 30 minutes, depending on the individual's ability and how they feel, how many days post-chemotherapy it might be. We know that those couple days post-chemo are a little bit more challenging than, say, the week or two thereafter.
Yeah. I love the idea of, instead of bringing over a cake, to offer to walk with somebody. It might actually be just as good for their heart and soul, and might actually be helpful in their survivorship journey. Tara, can you talk a little bit? Melinda had mentioned resistance training and walking. Is one better than the other? Do you prescribe both to your patients? How much of each? What should patients be aware of?
Yeah, and I'll welcome Melinda to chime in too. But, I have to say for a long time, the only thing I was really recommending to my patients was walking. And that's a lot because of the trials leading into our most recent study showed the benefits of walking. It's free for most people. If you have a safe place, you can do it right out of your home. I have to say that the evidence is emerging that also strength training is extremely beneficial. And I feel like it's been undervalued socially because, at least in the female population that I take care of, very few women are strength training on a routine basis. But it really, I think, points towards easier treatment completion. There's some data that suggests that when strength training is added. So cardiovascular and strength training are both two parts of a yin and a yang to exercise that I think we need to really be enforcing both of them. And Melinda, I'd love to hear you tag on to that.
Yeah, I agree with that. I mean, first and foremost, if we just get people from going from not very much to doing something, and if they choose the walking and are not able to, or they're not really enjoying the strength training, then that's better than not doing either, or vice versa. We have found that some of our participants have really appreciated the home-based strength training program, and that was easier for them to do than to get outside and go walking. And the nice thing is nowadays, if someone has an iPhone or an iPad, there's so many apps that they can download for free that do a different daily workout, whether it be a Pilates or a resistance strength training program. We've developed one as well for participants, but I encourage walking and or strength training. While both is fantastic, just doing something that really makes them feel good and is easier for them to initiate is probably a good place to start.
Yeah. And one of the things that you mentioned was that it's free and doesn't really require a lot of equipment. So even the strength training, Tara, can you talk a little bit about what you are advocating? I mean, some people, when they hear strength training, they think, geez, I'm going to need to go to the gym. I'm going to need to pick up heavy weights. But other people might say, you know what, if I have a couple of jugs of laundry detergent, I can do a bit of strength training in my own home. Can you talk a little bit about that?
Yeah, you're reminding me that I used to tell my 80-year-old grandmother to just, bicep curl a soup can. Because she wasn't doing anything and she would do this in her kitchen while she was cooking. I think we overlook body weight strength training, right? So there are simple moves that can place a load on certain parts of your body, like a plank or a squat, that again requires no equipment at all. And there's also resistance bands that you can buy on the internet or at your local department stores. And, those are also provide some just natural resistance that don't require massive number of weights and dumbbells. I think we're really evolving with how we talk about strength training. It's no longer just beefing up to get big muscles.
Well, that's great information. We are going to take a short break for a medical minute. Please stay tuned to learn more about exercise and breast cancer with my guests, Dr. Tara Sanft and Melinda Irwin.
Funding for Yale Cancer Answers comes from Smilo Cancer Hospital, where spiritual care offers support to patients seeking peace in the midst of their cancer journey while respecting the unique philosophies, spiritualities, and religions of patients and caregivers. SmiloCancerHospital.org. The American Cancer Society estimates that more than 65,000 Americans will be diagnosed with head and neck cancer this year. making up about 4% of all cancers diagnosed. When detected early, however, head and neck cancers are easily treated and highly curable. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilow Cancer Hospital, to test innovative new treatments for head and neck cancers. Yale Cancer Center was recently awarded grants from the National Institutes of Health to fund the Yale Head and Neck Cancer Specialized Program of Research Excellence, or SPORE, to address critical barriers to treatment of head and neck squamous cell carcinoma due to resistance to immune, DNA-damaging, and targeted therapy. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anise Chagpar, and I'm joined tonight by my guests, Dr. Tara Sanft and Melinda Irwin. We're talking about exercise as a standard of care for women with breast cancer. Now, before the break, we were talking about the value of exercise and how there have been a number of studies that have demonstrated that it improves quality of life, it can improve chemotherapy completion rates. Overall, it's just good for us. And so, Tara, maybe you can talk a little bit about how it is now becoming a standard of care.
I'm so excited to see exercise become a part of the treatment plan. And, one way that we see this is in program standards, as you mentioned, and the National Accreditation Program for Breast Centers is one of those programs that's been in existence for quite some time. And their goal is really to make sure that NAPBC accredited programs are offering all the components of care that make care excellent. And recently, they've just revamped their standards. And I'm just going to read one of the lines from the standard. And to me, this, as a patient experience officer, speaks volumes. They say that patients must be viewed in the context of their entire personhood. And I just think that is what we should all be doing across medicine. And I love to see that in writing. And part of that personhood includes how someone is functioning. So really starting at diagnosis and spanning throughout the treatment trajectory and into survivorship, all patients must be considered for functional assessment. And the program standards want to see documentation of exercise therapy recommendations.
Melinda, I want to go back to you. What are the recommendations that, based on the evidence, doctors should be suggesting? I mean, we talked about the 2.5 hours being the current guidelines, but something being better than nothing. Can you talk a little bit about, what you would suggest as an initial recommendation, both from the walking standpoint as well as from a strength training standpoint? Where should patients and doctors start?
Yeah, I'd like to just first make two quick comments. I really appreciate what Tara just read and the importance of focusing on the whole person. And I'm reminded of one of our study participants. In fact, there were many study participants in our trial that was of exercise during chemotherapy, where these women reported at the end of the intervention, which was at the end of their chemotherapy, that they felt stronger and physically more fit at the end of chemotherapy than before. And the program we offered them was a primarily brisk walking, upwards of 2.5 hours per week, and twice a week at home resistance strength training program with dumbbells that were 2 pounds and 5 pounds, and also resistance bands. The other thing to note is that exercise has benefits also for other outcomes, including cardiovascular disease and hypertension and cholesterol and diabetes. So while it's improving cancer outcomes, it's also improving other outcomes we know that are important to patients with breast cancer. I also think it's important that the research and the focus shift on helping providers be able to not just recommend exercise, but who to refer them to. There's survivorship clinics and programs at cancer centers, cancer hospitals, and community-based organizations. So it's important that we just don't recommend it, but we follow up with who to refer them to, and or writing them a prescription that meets what they're able to do in their neighborhood or in their home. If they just leave being told to walk more and maybe do some resistance training, that's probably a little bit more challenging for the patient to understand how much, when, and where. So if we can get even more specific with the referral process and or writing a prescription, that would be really important to take these standards of incorporating physical activity into clinical care.
Yeah. And one of the things, Tara, in the studies, there was somebody kind of presumably checking in on these patients. How are you doing? Did you do your walking? Kind of like a coach. What are the resources available to patients in the community in terms of having someone check in on them and provide this kind of ongoing support in terms of their exercise?
Yeah, well, and I'm glad you asked this. I do want to mention that, in addition to prescribing, let's say, a walking program, or again, if there's something you like, do that because that's the best form of exercise. There is also a movement towards more formal assessments and prescriptions through professionally trained physical therapists, for instance. And many places label this an oncology rehab program. And often if it's instilled sort of at diagnosis before all your treatments get started, we call it prehab. So rehab and prehab. And for extensive surgeries or extensive treatments, or an individual who has a lot of issues going on that may impact their safety as it relates to exercise, a physical therapist or an onc rehab program is definitely the way to go. And again, not every place is fortunate to enjoy these resources, but I think putting them into the standards will ensure that institutions who want to be accredited will spend more investment in getting these programs up and running. In terms of the coaching or having someone check in, we had our trained interventionists check in with the patients 11 times over the course of the year. So again, it wasn't a daily check-in process. It was more intense at the beginning and then spaced out over the following months. There are other wonderful community programs. One that comes to mind that my patients love is the Live Strong program, which is a national program offered at many YMCAs that is specific to cancer patients, and the programming allows for more of a community feel. So if you like to exercise with a group of people who have been through something that, is not exactly your experience, but maybe close to it because of the common thread of being a cancer patient or a cancer survivor, this is really something that I encourage people to take advantage of. And then, of course, there's other supervised programs at community centers and things where you can do not as intense exercise maybe, but also build a community and whatever exercise that feels right for you.
Yeah. Melinda, I'm just thinking about people who may be listening to this and thinking, I was diagnosed, last year, last month, a decade ago, and wasn't really provided this recommendation. But in hearing about the benefits of exercise, it may be helpful for me to start, even though I didn't start at the time of diagnosis. 2 questions. First, is it still valuable to start a week, a month, a decade after diagnosis? And second, where can people get resources if they're finished their cancer journey, at least their acute cancer journey? Are the recommendations that you had provided to patients available in a free online accessible kind of platform where survivors can access that?
Yeah, really important questions. And I would say, yes, it's never too late to start a program, whether they were diagnosed yesterday or 10, 20 years ago. I would say the first stop could be outreach to, if they're still regularly seeing their oncologist, reaching out to them or to their primary care doctor and asking them about resources that might be available at the hospital or in the community. They might have documents available that list resources. If they're just diagnosed or just recently completing treatment, I would like to see hospitals think about their cardiovascular rehab programs, cardiac rehab programs that are available, and thinking about how to share resources, either to broaden it to include a cancer rehab program. And many times those are offered, at least cardiac rehab is offered right after a cardiovascular event and maybe not years later. But I know, for example, survivorship programs, they might see patients anytime after diagnosis, upward to 10, 20 years after diagnosis. And so that's a really good first stop as well to reach out to those survivorship programs. Also, Tara mentioned the YMCA, the Live Strong program at YMCA. Many YMCAs also offer related programs, not necessarily specific to cancer, but for example, the diabetes prevention program is open, that focuses on exercise and nutrition. Those are at YMCAs. There's programs called the Silver Sneakers exercise programs at the Y for people of a certain age. Medicare reimburses programs that are more weight management focused, that includes exercise. So definitely talking to the primary care physician and the oncologist can provide some information and as a good starting point.
If I could add into that, we do see patients long after treatment has ended in our multidisciplinary clinic, and we always reminisce or say that patients find us when they need us. And then our other mantra is that we meet them where they're at. So, there are people who used to run marathons and then maybe had extensive cancer treatment and thought, I don't think I could ever do that again. But eventually they want to know if they could. And so, I think it's never too late to reevaluate goals and hopes and dreams. And that can come anytime after cancer treatment.
Yeah. One of the questions that I'm thinking about is that there must be some barriers, right, to getting patients to exercise. One might be, I'm too tired. One might be, I don't have enough time. One might be, I'm too stressed out. How do you counsel patients about getting over those barriers? Tara?
Yeah, I think these are really good points and so true. Our culture, our work culture in this country is one of exhaustion, time limited resources, and a lot of stress. So I think validating that is really important. And then, we try to encourage patients that whatever they're doing, is there a way to do a little bit more or to make certain trade-offs so that you're still meeting your goals, and I've had the privilege of working with a physical therapist who does all of our exercise counseling. And, he has like a little tip sheet on ways to get in a little bit more movement, and I think everyone understands the concept of parking in the furthest away parking spot. But that counts. Like, are we doing that? I would love to see the stairways, even in our hospitals, be the central focus rather than the elevator banks.
Dr. Tara Sanft is an associate professor of medicine and medical oncology, and Dr. Melinda Irwin is the Susan Dwight Bliss Professor of Epidemiology at the Yale School of Medicine. If you have questions, the address is canceranswers@yale.edu. And past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next week to learn more about the fight against cancer here on Connecticut Public Radio. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.